our first webinar here of the year, where we're talking about the impact that COVID-19 has had on group health coverage. I want to welcome everyone this morning. My name is Jason Powers, for those that have not met. You are in listen-only mode. So the format for the day here, we'll have a Q&A feature actually in the Zoom app. You can actually click on that Q&A box and add your questions for any specific questions that are in relation to the topic that we're discussing here today. The chat box, there's also a chat box there. If you're having any kind of technical issues, we have the rest of the Legacy Brokers team available to help with technical issues, and they'll be monitoring that chat box. We've got Rick Finfera, our CEO, is co-hosting with me today. I don't think he's sharing his video at the moment, but I think he sent a broadcast message out to everyone calling sunshine. So the rest of the team is here as well. So we've got Bob Dill is in the background, Stephanie Douglas and Tyler Bean, all ready to help with any technical issues you may be having during the broadcast of this webinar. Last but not least, if you just need to interject throughout the process and can't wait till the end, feel free to raise your hand, and we'll address any questions or issues you've got at that point. But try to use that Q&A feature. We'll circle back at the very end and broadcast those questions and those answers so that we're answering everything you got. After today, if you've got questions related to the topics that we're discussing, as always, feel free to email me directly. You can call me directly, whether it's after this meeting today or sometime next week as you're meeting with clients and questions get brought up. Feel free to reach out. We really do mean it when we say we've got your back. So we're here for the long haul. As many of you know, we are working remotely. We launched remote workplaces last week, and we're finishing up our first full week of being remote. But we have 100% operational capabilities, so anybody on the team should be able to answer any questions that arise. We've also built a page on our new website, and we'll cover that in more detail toward the end, where we have added links to specific responses from carriers that we've received over the last couple of weeks. And then last but not least, after today, next week on Wednesday, April 1st, we are co-hosting a webinar at 2:30 in the afternoon with Omni HR. They are a professional HR consulting firm, so that we can look at things from really from client-specific, any kind of client-specific needs, looking at those questions as they pertain to the HR side of the house, not just the benefit side. So be on the lookout for those details, and we'll get going. So our agenda for today, we're just going to kind of talk through a broad scope of what's going on with COVID-19, how it impacts group health coverage. We'll go through some of the new coverages that have been announced, or different carriers have announced different coverages. There seems to be some bit of a uniform communication in how those things are coming out, but there is not uniform coverage. So we want to make sure that we cover what those look like. Temporary layoffs and furloughs or reduction of hours, how that applies to the health plan, and how the layoffs or furloughs are impacted with the COVID-19 shutdowns, and what happens to coverage there. We'll talk a little bit about some billing issues, grace periods, things of that nature, mid-year plan changes. We'll discuss renewals, how that impacts open enrollment, and then my favorite topic, the self-funded plans. We'll look at some different things that are specific to a self-funded plan that you want to be sure that you're on the lookout for. We'll go through at the very end and show you our resource page on our website, and then have a Q&A session where we can answer some of the questions you've had along the way. So first, let's kind of dive into the legislation that hit in the last week. Families First Coronavirus Response Act, HR 6201, that hit, and the most immediate thing that happened was that it required all group health plans and health insurance issuers that offer group or individual health insurance coverage, and that includes all the grandfather plans. Those plans now have to cover COVID-19 testing and certain COVID-19 testing related items and services without cost sharing. So no deductibles, no co-payments, and no co-insurance for the members, and without prior authorization or other medical management requirements. So essentially breaking down the barrier for members of health plans to get access to testing. Obviously, what also came about was that that testing would run through not just be covered, but run through the plan. So we'll kind of cover that on the self-funded side, how that impacts self-funded plans. Our NAHU just released a memo this morning that carriers are already predicting double-digit increases for next year based on what they're seeing for testing cost, so and then treatment as well. So that will significantly have an impact on renewals next year for sure. Other things that got released were we've seen carriers offer telemedicine benefits. For those that, there's a lot of plans that have telemedicine already included in their plan, but we have seen some of the plans issue telemedicine coverage for the first time. They may be adding that on a temporary basis. Some of it have done it with no copays. Others still have a copay attached. Something that was interesting that came out from the federal side was that telemedicine benefits can be offered with no copay, as well as COVID testing with no copay, and have no impact on HSA qualifications. So if you have an HSA plan, those benefits can be offered with no cost share and not have an impact on whether or not you can contribute to your health savings account. We have run into a few plans that have said they're not really the carriers or the administrators saying that they're not going to offer the addition of telemedicine benefits mid-year. In those cases, we found there's a company called MeMD that actually issued a 90-day COVID emergency plan that they can actually implement in 1 to 4 days. So, if you've got a plan that is in need of something like that, be sure to reach out, and we'll get you some information on that. The other piece of coverage that we've seen come out is carriers kind of taking a position on opening up the restrictions on early prescription refills. For those that aren't aware, typically you can't refill your prescription early. You have to, for most medications, you'll have to wait until you're within a week of running out before you can refill your medications. A lot of pharmacy benefit managers have come out and lifted that restriction. We expect that restriction to come back after the smoke clears here on COVID-19. But right now, effective, I think it was effective earlier this week, most plans have lifted that restriction on early prescription refills. So that's it for coverages. Probably the most critical question we had starting Monday of last week, when we first caught wind of the 15-day stop the spread guidelines issued by the Trump administration. The questions that we started asking were, when companies voluntarily start laying off employees or sending them home on administrative leave, how does that impact coverage? And so that's really the bulk of our concern. And what we found was that in some summary plan descriptions, there is language or provisions that allow for coverage to be continued in some cases up to 90 days or 12 weeks. Other cases, it may just be 30 days. It just kind of depends on the language in the summary plan description. Some documents don't have any language with regard to leave of absence. So we really encourage you to take a look at your policies. Every client is going to be different. Every carrier is going to be different. The one thing that we're finding that kind of gets missed in the translation of that is, how are the premiums going to be paid? We have seen some clients, some groups have said, we're going to send people home without pay, but we're going to pay their premiums while they're out. Others have said they're going to send them home without pay, and they're going to pay, the client is going to pay their portion of the premiums, but they're going to collect the rest of it from employees that want to continue coverage while they're out. Others have said they're not going to pay it at all. And so what happens then is you really have to look at continuation of coverage provisions in the plan. So just because the carrier says they're going to allow the continuation of coverage does not mean that they're going to allow it for free. So someone's got to pay that premium. In the event that continuation does apply, you'll want to look at what kind of continuation applies. If for groups of more than 20 employees, obviously COBRA, the federal law COBRA kicks in. That's a pretty easy one to understand. COBRA's got to be offered. It's got to be offered within 14 days of notification to the plan that their coverage should terminate. And then the member has 60 days to elect coverage from that date, and then another 45 days to pay their premiums. So for the most part, I think we all know those provisions. In most cases, if the group is less than 20 employees, state continuation of coverage would apply, depending on your state laws. The concern there is that if you're on a small group, level funded or self-funded plan, most of those plans have an ERISA preemption that does not require them to follow state law. In most cases, small group level funded plans actually don't allow state continuation of coverage. So you'll want to double check your plan documents, make sure that you understand what kind of continuation of coverage applies if you do have a group under 20 that's self-funded. In those cases, that termination of coverage or the layoff or the reduction of hours, however you want to classify it, that would trigger a special enrollment period for that individual for the marketplace. So there could be some opportunity to assist your members by looking at their situation and helping them enroll if that's the case. And the other big question was, we're all assuming that this is going to be a temporary crisis, and we'll all return to some sense of normalcy where we can all see each other again. And when we do, what happens to those employees that come back to work? And that's where you'll want to look at rehire provisions. What language is in the plan for employees that were in a temporary layoff or were terminated in some case, and then they get brought back. So rehire provisions would apply. You'll want to read through those because every carrier has got a different rehire provision. We read one yesterday in a plan document that was 30. If they're rehired within 31 days, the member could come back with no waiting period. But if you read a little further in that document, the coverage doesn't start until first of the month after the rehire. So there could potentially be gaps of coverage, and you just want to double check your specific client's plan documents and policy language. Some of those rehire provisions we've seen, as long as they're rehired within the same year, 12 months, that they can come back on the plan without being subjected to the new hire waiting period. But they're not all uniform across the board, and that was cause for concern for us. Billing is going to be kind of interesting. We've had a lot of questions about grace periods, and so far we've seen just a couple of companies come out and offer up some additional grace period, but it's important that your clients understand there's typically a 30-day grace period for billing and paying their invoices timely. National General actually released some information yesterday or the day before that talks about a 60-day reinstatement policy, but it certainly doesn't give them an additional 30 days of grace period, so you'll want to be sure that you read that very carefully, ask those questions if you don't have the answers already, and just pay attention to what that looks like. If it's a self-funded plan, while the grace period could exist for the admin fees and the stop-loss premiums, it's really important for employers to understand that they need to continue funding the plan. Any delays in funding their plan would create delays in claims payment. Administrators are not going to pay claims unless they have funding from those employers. So if you've got self-funded plans, make sure that those employers understand that playing that grace period game for 30 days could result in a lot of claims delays. Plan changes. This one's kind of simple. There's really not a lot of discussion about making plan changes off cycle, but there have been some questions about being able to offer a mid-year plan change. Most of your traditional ACA fully insured plans allow mid-cycle plan changes, but the self-funded plans really you've got to stay with that plan throughout the year. But if you've got a client that's looking at potentially look at a mid-year plan change to help reduce costs during this downtime, the other thing to really think about is that the federal guidelines require a 60-day notice for any material modifications to the benefits unless it's done during the renewal season. So if a policy is making off-cycle plan changes, they really may not be able to realize the impact of those changes for 60 days anyway. The feds have we've not seen any language come out yet that has lifted that restriction for employers that may be looking to minimize costs during this downtime by lifting that restriction of 60-day notice. So something to look for there. Not all plans renew January 1st. I know it's crazy to think that, but we do have groups that we're processing in our team for April 1st renewals and May 1st renewals, as well as getting ready for the June 1 renewal cycle. Now more than ever, timing is critical. Don't wait till the last minute to get those renewals processed. Every insurance carrier seems to be working from remote locations, and so communication with carriers has been a little difficult. I'll say that most of the carriers have been tied up trying to answer the questions we've been asking them about COVID-19's impact on group health coverage. But for the most part, we're getting things done with those carriers, but I would not trust their ability to process renewals quickly when they're all working from home. So do us a favor, at least do yourself a favor, and make sure that you're out in front of those renewals as quickly as possible, talking with your clients and getting them to make decisions. We did see some language from a couple of carriers that extended open enrollment periods. So typically, an open enrollment period is going to be the month before the renewal date. So a May 1st renewal would have the entire month of April maybe for an open enrollment period to ask employees what kind of changes they want to make to their policy or their enrollment election. And we did see some language come out from some carriers where they're offering the additional month after the effective date, or maybe a couple of weeks after the effective date of the policy, to capture open enrollment changes. I think as we get through this weekend and we get into next week and we see what the new numbers are from the coronavirus task force, and we see some new guidance from the feds, we may see some additional leniency on that open enrollment period. Surprisingly, we had United Healthcare. I'll just call them out for it. United Healthcare issued something completely unique, and that was a special enrollment opportunity off cycle for anyone that did not enroll in coverage during the most recent renewal open enrollment. They are allowing those employees to make a special enrollment into the plan effective April 1st. And I think that's essentially a sign that if someone doesn't have coverage, and they want to make sure that those members have access to care. So that was that is unique to United Healthcare. It's not something we've seen across the board, but I'll say that it seems like when one carrier does one thing, other carriers start to follow suit. So we'll see what how that infects other carriers. Now on to self-funded plans. This is by far our specialty here at Legacy Brokers is small group self-funding and level funded plans. And so this is something that's I'm very passionate about. I hope that if you've got self-funded plans that you do reach out to us so that we can talk to you directly about your clients and the impact that all this has on your client's plan. I mentioned that self-funded plans have to be funded by an employer first. I have to reiterate that because we're seeing a lot of discussion of stretching that grace period out, and that's just going to cause claims payment delays, and that's going to create even more. Joe's on the call here. I think Joe calls them management opportunities. So do yourself a favor and remind your client of their responsibility to fund those claims. Minimum attachment point is something that will typically you'll want to look at in a more sophisticated independent TPA with a separate stop loss carrier arrangement. If you're in a carrier model like All Savers or Humana's level funded or Aetna AFA, there really are there's no minimum attachment point. And what that is, for those that don't know that term, in a self-funded plan, there's the claims bucket is what we're looking at. And in that claims bucket, when we establish what that claims bucket's going to look like monthly, it's really an annualized maximum liability for the plan. And on day one of the policy, the stop loss carrier can set a minimum liability in case the group's demographics change or their census changes throughout the year. It protects the stop loss carrier from enrolling a case of 70 employees on day one, and then on day 30 they've only got 10 people that are participating, and it's the 10 sickest people on the plan. So it's a risk management provision in the stop loss policy. So why is that important? Because as we talk about layoffs and furloughs and reduction of hours, what we're talking about is potentially having a drastic change in census that's enrolled in a self-funded plan. If that's the case, and you do have clients that are larger groups that have attachment point issues, you'll want to be sure that you talk to your client about that specific risk. A great example is we know of a group of about 300 people that that locked in their rates at renewal on January 1st with 300 people and set their maximum liability for the plan at a certain number, and they're going through layoffs right now. We expect them to go down probably 50%. So that instead of 300, now we probably only have 150 that are going to be insured through the next couple of months. And what that does is it could double the liability per person that's left. So if you've got additional questions about that, reach out and we'll be sure to address any concerns you have. Another one is actively at work provisions for large claims. The stop loss carriers, and there are many stop loss carriers in the market, so it's really hard to put a blanket statement on this for all, but something to look for is how is your stop loss carrier for your group's plan handling the actively at work provision during this layoff? I know for a fact there are a few agents on this call today who, before COVID-19, have seen actively, or the active at work status request form that comes out when a large claim does hit. And what the stop loss carrier is looking for is, if we've got $1 million claim, how is this person still covered? Are they, if they're not working? So we have seen some leniency come out from the carriers that we work with, but not all of them have issued any kind of leniency. And then that just kind of goes back to our initial conversation about continuation of coverage. The key there is just making sure that if someone is not coming to work anymore, that you're following the provisions in the plan to enable their continuation of coverage. How are they staying on the plan? If you can answer that with certainty, then you're probably okay. Another thing, with this Families First Coronavirus Response Act, we talk about free testing. The government says that everybody can get free testing. Well, that's free to the patient, the member, but it's not free to the employer. If you're in a self-funded plan, that plan is the financial guarantor for those tests. So if the plan is now covering those tests, that could have an impact on your loss ratios for a self-funded plan, which could then have an impact on your stop loss numbers when you come to renewal. On the fully insured side, I'd say that it's free means free to patient, but it's not free to the insurance company. The insurance company is covering those tests, and that will have an impact on renewal for sure. And then the last thing I've got here is the stop loss carrier requiring a written plan amendment to cover the testing? So it's one thing for the feds to say that you've got to pay for it, but the stop loss carrier doesn't necessarily have to include it in their losses. So they don't have to include it towards the aggregate max liability, or they don't have to include it towards the specific. Many carriers have come out and expressly said that they will cover it. They will consider covering it towards the specific deductible or the individual stop loss, the aggregate liability, or the maximum attachment point. But many have said that it requires a written plan amendment from the employer, who is the plan sponsor, to actually cover it under the stop loss. So just double check your plans. On the small group self-funded side, if you're talking about, again, Humana level funded, or Aetna AFA, or Anthem balance funding, or some of these carrier models, they're not requiring a written plan amendment because they put all that language together in a blanket document across the board for their filed plans. So this is really in relation to a more sophisticated self-funded plan that's set up. Again, I just remind you that if you've got additional questions or client-specific questions for me, I am open ears. I've been fielding questions for the last couple of weeks via email. You can always call me directly. That's my cell phone number, but that's my direct line. So if you've got questions that are posed by specific clients or prospects that you're talking to, feel free to reach out. We've built a website, our page on our website that wanted to show you here. Our new site under Insights. We've got the carrier responses. How does this impact group health coverage? Inside that post, this really kind of resulted from Monday, March 16th, when we saw the 15 days to slow the spread press conference. Almost immediately, we really started calling carriers and asking the question, hey, if if an employer temporarily lays off people for the next couple of weeks to abide by this 15 days to slow the spread, how's that going to impact coverage? And then we started thinking, well, what happens if this is, this isn't a voluntary layoff? This is maybe a municipality that says we're gonna take it a step further and close all the bars and restaurants. Well, what happened Monday night? It's all in Kansas City. All the bars and restaurants were closed on Tuesday, and then we thought, well, what happens if it kind of leaches out into the countywide or statewide stay-at-home orders? And that's what came next. So really, we were pushing insurance companies as much as possible to get answers as quickly as possible. They didn't have them right away, and it took really. I mean, we have one carrier that we still haven't heard from with an official response, and it's one of the largest carriers here in our market. So what we've done is we've gathered all of those carriers' responses on our page, so you can click on links. For example, Aetna issued a pretty nice FAQ, and one of the first questions asked is, our company's reducing hours. Are we able to keep our employees covered? The answer was yes, you can, as long as you continue to pay your bill and you don't terminate the employees. And it's available through July 31st. So one could read that and say, yep, that's what the carriers are doing. But the problem is, if you come over to Humana's response, Humana did a nice job of putting together their FAQ, and they're saying, hey, yeah, we're going to relax the requirement that employees need to be actively working, but it's only through May 31st. Monthly premium is required on both the fully insured and the self-funded plans. So they're not uniform across the board. They are different. And if there's a carrier that doesn't have a link, the reason they don't have a link is because we haven't had an official response from those carriers. So that's available to you as we move past today, and we'll be updating that site as we continue to get additional information. As we all know, things kind of change day to day, hour by hour. So we're doing our best to stay on top of that information and provide those resources to you. At this point, we'll jump over to our Q&A and double check here. I do not see any questions in the Q&A box. Yeah, I'm not seeing any questions, so I'll leave it open here for a couple of seconds. Also, feel free to raise your hand. Let's see here. I'm not seeing any questions and nobody raising hands. Nope. What's a good question we could ask clients to engage them? Love the way you think, Mark. I think there's a lot of fear of the unknown at this point, and so I think the first question to ask is, how are you doing? How are you doing amidst all of this? What are they doing? Do they offer coverage, and if they do, what are they doing in the meantime? If they are not deemed an essential service and they're sending employees home without pay, or even if they're sending them home with pay, what are they doing as it relates to their health plan? And if they don't have any guidance, I think that's where maybe you could offer them guidance. Our webinar next week is going to be geared toward a more client-focused conversation and less of an agent-focused conversation that we're co-hosting with an HR firm to really kind of address some of the HR questions. I mean, there's different packages of legislation that have hit. There's different requirements. We didn't even talk about it in our webinar today, but there's the whole emergency FMLA piece that comes into play that requires employers continue to pay people who are out due to coronavirus. So those are things that I think it'd be helpful to offer some guidance for them and kind of point them in the right direction. And I think it'd be a great way to engage both clients and prospective clients for sure. Great question. Any other questions? I'll leave it open here for another minute or two. Another follow-up from Mark. Is there a list of the new measures that they might be interested in? There are. The answer is yes. If we're talking more carrier specific, then I think the page that we've built provides some guidance. If you're talking more in terms of the financial packages, matter of fact, Mark, I'm going to unmute you so we can talk through some of your questions, if that's okay. Are you there?
Testing 1, 2.
Well, hi there.
Hi.
Welcome to the show. So yeah, are you talking more carrier specific or more the financial, the stimulus?
No, I think that people don't really know even about the new act that you talked about with the COVID-19 Act, where we're mandatorily allowing for testing in all plans. And I'd like to know more if that's included in short-term major medical leave. They seem to leave everything out. But in the long run, it seems like there's been a lot of legislation enacted and a lot of measures that are being pushed forward that a lot of clients don't know about. And the fun part about this is that we are a resource and that we can call them, whether they're established clients or just people that we're looking to make contact with, and say, hey, well, did you hear about this? Or hey, did you know this? And I think the HR, I'm really excited about the HR teleconference you're going to as well, because I believe that a lot of this is HR oriented, and your HR people are going to just eat this stuff up. So have a gatekeeper that is trying to learn all this stuff. Then we become not just someone calling on you about your health insurance. We become this resource where we have the answers to questions that are out there.
Yep. No, I agree. I absolutely agree. So there are some other resources. Kind of hard to pinpoint which ones to share. But let me talk with the team. We may put together another page for some of those articles that we're seeing. Read a great piece yesterday from the Tax Foundation that kind of went into great detail about some of the SBA loans and the emergency funds there, and then obviously
that's a great point right there as well. The SBA loans. I mean, I've been invited to another webinar this week from some kids up in Wisconsin. I don't even know how I got on their list. But they are talking about how to apply for the SBA loans. Like I said, this is a crisis, and there's always an opportunity in any crisis to turn around and make it an opportunity. And my goal is definitely to stay in contact with my clients. But wow, what a great opportunity to talk with just local businesses and just say, hey, this is what we do, and we have the resources necessary to keep you up to date. And that just allows us to, when we emerge, or maybe we don't emerge. How long does it take to emerge? I mean, we're on lockdown for 30 days in Springfield. I mean, this is like day 2.
Yeah.
I mean, 30 days is a long time. So when we come out of this, or while we're in it, people are afraid, and they want to. The biggest weapon that we have to ease their fears is information. So that's what I'm wanting.
Yeah, for sure, for sure. Great points, Mark. Connie, it looks like you've got a question. Ah, hang on. There you are.
Follow up from Mark's question. Oh, I'm muted still. Hang on.
Nope, you're good.
Okay. All right. Mark, you had asked something about if the testing applied to short-term medical plans. I did reach out to Blue Cross of Kansas City because they have a pretty decent short-term medical plan right now. And they did confirm that anything COVID related is going to apply to any and all of their plans. I know down in Springfield, you don't have access to that particular plan. So but for those of you in Kansas City, if anybody else is selling it, that one does allow it. So that's good news.
Yep. Thank you.
Hey, Jason, this is Rick. I wanted to jump in real quick. Mark, you brought up a great point. I think there's a huge opportunity now to be that trusted advisor. I think that's what clients need right now is people to guide them along to action. And that it's also a great opportunity to prospect, quite frankly, and maybe not to get business now, but to be that advisor to guide people through this problematic period. And the things that we just talked about today are perfect examples of things that you can go talk to people like, hey, what are you doing? Like Jason said in the beginning, reaching out to say, hey, how are you doing? And then talk them through, hey, what are you doing? What's your situation look like? And then have you thought about this? Have you thought about that? And just help guide them and just be that trusted advisor. And then things will come at the right time. So just something to think about.
Thank you, Rick. All right. Well, everyone, I appreciate everyone jumping on today. It's a new format for us. We actually look forward to using this format in the future for some of our CE classes. Again, I would encourage you to mark your calendar for next Wednesday. We will have, let's see here, I can put it back on the screen. We'll have, there we go, Wednesday, April 1st at 2:30. We'll co-host that with Omni HR to talk more from the HR side of the house. Feel free to invite clients or prospects, prospective clients or people that you've been talking to that event. We'll get details out. We're hoping to get it out today, but it will very likely be first thing Monday. We'll send out the link to that event. And with that, we'll close out our first broadcast. Thanks, everyone. Have a great weekend.